It's Thursday, December 12th, and this is the Daily Medical News, where we bring you the top stories in clinical medicine, as well as a closer look at the day's biggest story. I'm Terry Rudd.
And I'm Nick Andrews. Today, new evidence supports a start to colorectal cancer screening at age 45.
Bariatric surgery may be linked to fewer cerebrovascular events.
Many Americans plan to avoid getting the flu shot. And now, the news.
And doctors are pushing back on a bipartisan bill to address surprise billing. There's new support for the American Cancer Society's 2018 qualified recommendation to start colorectal cancer screening sooner. The ACS changed its recommended start from 50 to 45 years in average risk individuals. Researchers at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire, analyzed registry data from more than 42,000 New Hampshire residents who underwent their first colonoscopy. They found that the prevalence of both advanced adenomas and clinically significant serrated polyps was closely similar for average-risk people aged 45 to 49 years and for those aged 50 to 54. The investigators presented their findings at the annual meeting of the American College of Gastroenterology. The ACS recommendation addressed a disturbing national trend, the climbing incidence of colorectal cancer in young adults. Indeed, the incidence increased by 55% among 20 to 49-year-olds during 1995 to 2016. That's despite incidence falling by 38% in people aged 50 years and older.
The benefits of bariatric surgery may include reduced cerebrovascular risk. Obese people who underwent bariatric surgery had a 2/3 lower rate of major cerebrovascular events than a matched group of obese residents who didn't. That's according to a retrospective study of 8,400 British patients. Researchers at Imperial College London presented the findings at the American Heart Association scientific sessions. During 11 years of average follow-up, the incidence of acute ischemic stroke, acute intracranial hemorrhage, subarachnoid hemorrhage, or transient ischemic attack was 0.4% in those who had surgery. It was 1.3% in those without bariatric surgery. That's a significant relative risk reduction of 65%. The cut in cerebrovascular events was mostly driven by a reduced rate of transient ischemic attacks, which is a potentially unreliable diagnosis. But the study researchers say the results also showed consistent reductions in the rates of acute ischemic strokes and of acute, non-traumatic intracranial hemorrhages.
As the 2019-2020 flu season took off, more than half of American adults still hadn't been vaccinated, and more than 1 in 3 said they weren't going to get a flu shot. That's according to a survey from the research organization NORC at the University of Chicago. Only 44% of 1,000 surveyed adults said they'd already received the vaccine as of November 11th. But 37% of respondents said they didn't intend to get one this season. Age was a strong determinant of vaccination status. Roughly a third of those aged 18 to 59 had gotten their flu shot, compared with 2/3 of people aged 60 and older. Of the respondents with children younger than 18, 43% said they weren't planning to have their children vaccinated. Top reasons for not getting vaccinated include concern about side effects, mentioned by 37% of those avoiding the flu shot. That was followed by belief that the vaccine doesn't work very well, cited by 36%.
Compromise bipartisan legislation to address surprise medical bills is getting pushback from physician groups. House and Senate leaders unveiled compromise bill December 9th that includes rate setting for small surprise billing. It also includes arbitration for larger billing sums at a lower threshold than what was originally proposed. The new bill is part of a broader Lower Health Care Costs Act. The legislation would protect patients from surprise medical bills related to emergency care, and it would hold them responsible for in-network cost-sharing rates for out-of-network care provided at an in-network facility without their informed consent. At minimum, providers would be paid the local market-based median in-network negotiated rate for services with a median rate under a $750 threshold. When the median exceeds $750, the provider or insurer would be allowed to choose an arbitration process to resolve payment disputes. The bill also bans out-of-network facilities and providers from sending balance bills for more than in-network cost-sharing amounts. Physician groups warn the legislation is a give-back to insurers that puts healthcare professionals at a disadvantage when negotiating to be included in insurer networks. Of particular concern is the $750 threshold. At that level, the vast majority of services doctors provide won't be able to go to arbitration. That's the warning from Christian Shalgain, Director of the Advocacy of Health Policy at the American College of Surgeons. And by taking arbitration off the table, Mr. Shalgain says insurers have no incentive to negotiate in good faith with doctors to ensure that doctors are getting paid for the services they provide.
And that's it for today's Daily Medical News. Be sure to check out the newest episodes of Dermatology Weekly and Blood and Cancer, available today and every Thursday. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. That's it for the Daily Medical News. We'll be back tomorrow.